There's a strip of fat sitting around your midsection right now, and it's not just sitting there doing nothing. It's producing chemicals, inflammatory chemicals, hormonal signals, clotting factors, substances that are actively remodeling your arteries from the inside out. And the width of your waist is telling you with surprising precision how much of that damage is happening right now. We've been trained to think about heart disease risk in terms of cholesterol numbers, blood pressure readings, and family history. And those things matter. But what most people have never been told is that the fat around your waist is not the same as fat anywhere else on your body. It's metabolically unique. It behaves more like an organ than a storage depot, and it is now considered one of the single strongest predictors of cardiovascular events in adults over 45. Stronger than BMI, stronger than total cholesterol in many studies, stronger than almost anything you can measure without a blood draw. Your doctor weighs you, your doctor checks your BMI, but BMI doesn't distinguish between muscle and fat, and it certainly doesn't tell you where that fat is sitting. A person with a normal BMI and a wide waist can be at dramatically higher cardiovascular risk than someone with a high BMI who carries their weight in their hips and legs. That distinction has been buried in the medical literature for over 20 years, and most people still don't know about it. Your waist isn't just a number on a tape measure. It's a window into the metabolic engine that's either protecting your heart or destroying it. Hi, I'm Dr. Alex. I'm an emergency medicine doctor, and after nearly 10 years in the AANDE, I've seen what cardiovascular disease looks like when it arrives unannounced. The heart attack at 54 in someone who thought they were fine because their last blood test was normal. The stroke at 61 in a patient whose BMI was technically in the healthy range. The cardiac arrest in someone who had been told for years that their cholesterol was borderline and nothing to worry about. My goal now is to help people understand the warning signals their body is already giving them so they can act before they end up in my department. Now, before we go deeper, I want to make you a promise. I promise to keep creating the most helpful, science-grounded videos I possibly can to help you live a longer, healthier life. All I ask in return is that you give this channel a chance and hit the subscribe button. If you get to the end of this video and you don't feel like you've learned something genuinely valuable, something that changes how you think about your own risk, then feel free to unsubscribe. No hard feelings at all. But if you give me your time, I'll give you everything I've learned from over a decade in frontline medicine. So please hit subscribe to help this channel reach more people who need this information. And let's get into the science. To understand why waist size matters so much for heart disease, you first need to understand that your body stores fat in two fundamentally different ways, and the distinction between them changes everything about your cardiovascular risk. The first type is called subcutaneous fat. This is the fat that sits just beneath your skin. It's the fat you can pinch on your arms, your thighs, your hips. It's the fat that most people think of when they think about body fat. And while nobody wants excess subcutaneous fat for cosmetic reasons, the truth is that from a metabolic standpoint, this fat is relatively harmless. It stores energy, it provides insulation, and it doesn't produce significant quantities of inflammatory chemicals. It's passive. The second type is called visceral fat. This is the fat that sits deep inside your abdominal cavity, packed around your liver, your kidneys, your intestines, and your pancreas. You can't pinch it, you can't see it directly, but you can measure its effects because visceral fat doesn't behave like a passive energy store. It behaves like an active endocrine organ. Visceral fat produces inflammatory cytokines, including interleukin-6 and tumor necrosis factor alpha, which enter the bloodstream and drive chronic, low-grade inflammation throughout the body. It produces a hormone called leptin, which at high levels contributes to insulin resistance and appetite dysregulation. It produces a substance called plasminogen activator inhibitor 1, or PAI1, which promotes blood clot formation. And it reduces production of adiponectin, a protective hormone that helps keep blood vessels flexible and insulin sensitivity high. So visceral fat is not just extra weight. It's a chemical factory that is actively producing the conditions for heart disease, stroke, and metabolic dysfunction. And the width of your waist is the single best external marker of how much visceral fat you're carrying. That's why a tape measure around your midsection tells you more about your cardiovascular risk than the number on your bathroom scale ever could. Now, for decades, the conventional approach to assessing body composition and heart disease risk has relied on BMI, body mass index. It's your weight in kilograms divided by your height in meters squared. It's simple, it's quick, and it's been used in virtually every doctor's surgery, clinical trial, and public health campaign for the last 50 years. And BMI isn't useless. At a population level, higher BMI does correlate with higher cardiovascular risk, but at the individual level, BMI has a serious blind spot. It cannot distinguish between a person who weighs 90 kilograms because they're muscular and a person who weighs 90 kilograms because they're carrying visceral fat around their organs. It cannot tell you where the fat is, and as we've just established, where the fat is changes everything. This is why there are millions of people walking around with normal BMIs who are metabolically obese. Their weight is fine, their waist is not. They have high levels of visceral fat, elevated inflammatory markers, early insulin resistance, and arterial stiffness that is quietly building toward a cardiovascular event. The medical system has been reassuring them based on a number that doesn't capture their actual risk, and that's a dangerous gap. So here's the mechanism that connects your waist directly to your heart, and it's a pathway that most people have never been told about. Visceral fat doesn't just release inflammatory chemicals into general circulation. It has a direct anatomical connection to your liver through what's called the portal venous system. Blood draining from your visceral fat flows directly to the liver before it reaches the rest of your body. That means the liver is the first organ to receive the full concentration of inflammatory cytokines, free fatty acids, and hormonal signals produced by visceral fat. When the liver is constantly bathed in these signals, several things happen. First, it becomes insulin resistant. A liver that can't respond properly to insulin starts overproducing glucose, which raises blood sugar even when you haven't eaten. Second, it begins producing excessive amounts of VLDL cholesterol, which is the precursor to the small, dense LDL particles that are most strongly associated with arterial plaque formation. Third, it ramps up production of C-reactive protein and fibrinogen, both of which promote the inflammatory and clotting cascades that trigger heart attacks and strokes. Research published in The Lancet has demonstrated that waist circumference is independently associated with cardiovascular mortality even after controlling for BMI, blood pressure, cholesterol, smoking, and diabetes status. A separate large-scale study published in the European Heart Journal found that for every additional 5 centimeters of waist circumference, cardiovascular risk increased by roughly 7% in men and 9% in women, regardless of their overall body weight. So the pathway is clear. Visceral fat signals the liver. The liver responds by producing the very substances that cause atherosclerosis, insulin resistance, and clotting abnormalities. And your waist circumference is the external measurement that tells you how much visceral fat is driving that process. The tape measure is, in effect, measuring your liver's inflammatory burden without a single blood test. Now, if you're finding this helpful, please take a second to hit the like button. It genuinely helps this video reach more people who need to hear this information. And if you haven't subscribed yet, now is a great time. Let's keep going. So here's where everything converges into what I call the visceral fat trap. And once you see it, you'll understand why so many people develop heart disease despite doing what they believe is the right thing. The trap works like this. The modern diet is engineered to promote visceral fat accumulation specifically, not subcutaneous fat, visceral fat. Research has shown that diets high in refined carbohydrates and fructose preferentially drive fat storage into the abdominal cavity rather than under the skin. A study published in the Journal of Clinical Investigation demonstrated that participants who consumed fructose-sweetened beverages for 10 weeks gained significantly more visceral fat than those who consumed the same calories from glucose, even though their total weight gain was similar. The type of calorie determined where the fat went. At the same time, chronic stress elevates cortisol, and cortisol is one of the most potent drivers of visceral fat deposition. It literally redirects fat storage from the periphery to the abdomen. Poor sleep amplifies cortisol production further, and sedentary behavior reduces the rate at which visceral fat is metabolized because your muscles, when active, are the primary system that clears the free fatty acids visceral fat releases. So the trap closes from multiple directions simultaneously. The food you eat drives visceral fat accumulation. The stress you experience redirects fat storage to your abdomen. The sleep you're not getting keeps cortisol elevated, and the movement you're not doing prevents your body from clearing the damage. Your waist expands, your liver becomes increasingly inflamed, your arteries stiffen, and your cardiovascular risk climbs silently year after year without a single symptom until the event itself. That is the visceral fat trap, and it explains why heart disease remains the leading cause of death in the developed world despite 50 years of cholesterol-lowering advice. We've been measuring the wrong thing on the scale, treating the wrong number on the blood test, and ignoring the metabolic organs sitting around the waistline that's been driving the disease process the entire time. Let me give you some examples of how this shows up in daily life. It's the person who weighs the same as they did 10 years ago, but whose trousers have gone up 2 waist sizes, and they assume it's just part of aging. It's the person who exercises regularly, but eats a diet full of refined carbohydrates and sweetened drinks, and can't understand why their waist keeps growing despite being active. It's the person whose GP tells them their BMI is normal, so they assume their heart disease risk is low, while their visceral fat is quietly producing inflammatory chemicals that are stiffening their arteries every single day. None of this is their fault. The system never told them to measure the thing that actually mattered. Now here's the genuinely encouraging news. Visceral fat is the most metabolically responsive type of fat in your body. It is easier to lose than subcutaneous fat, not harder. Because visceral fat has a high density of adrenergic receptors, it responds rapidly to the right metabolic signals. The problem has never been that visceral fat is stubborn. The problem is that most people have been sending it the wrong signals. But let me be clear first. I'm not advocating for crash diets, extreme caloric restriction, or any approach that isn't sustainable long term. What I am saying is that specific, evidence-based changes to how you eat, move, sleep, and manage stress can produce meaningful reductions in visceral fat within weeks, not months. And those reductions translate directly into lower inflammatory markers, improved insulin sensitivity, and measurably reduced cardiovascular risk. Here are the 4 most impactful interventions. The first is reducing refined carbohydrate and fructose intake. This ties directly back to the mechanism we discussed. Remember, refined carbs and fructose preferentially drive fat storage into the visceral compartment. When you replace those calories with whole foods, particularly vegetables, legumes, nuts, and unprocessed proteins, your body stops receiving the signal to store fat around your organs. Research published in the American Journal of Clinical Nutrition has shown that participants who reduced added sugar and refined grain intake for 12 weeks showed significant reductions in visceral fat on imaging, even without deliberate caloric restriction. You don't have to eat less, you have to eat differently. The second intervention is regular moderate intensity exercise, and here's the critical detail most people miss. You don't need high intensity training to target visceral fat. In fact, moderate aerobic exercise, like brisk walking for 30 to 45 minutes 5 times per week, has been shown in research published in the journal Obesity to be more effective at reducing visceral fat than either high-intensity intervals or resistance training alone. The reason is that moderate sustained activity keeps your body in a fat oxidation zone where visceral fat is preferentially mobilized as fuel. Think of it like this. Visceral fat is the emergency fuel reserve your body draws on first during sustained moderate effort. A 40-minute brisk walk is the signal that tells your body to start burning that reserve. The third change involves managing cortisol through sleep and stress reduction. Remember, cortisol is the hormone that directs fat storage into the abdominal cavity. When cortisol stays chronically elevated, whether from poor sleep, psychological stress, or overtraining, your body keeps depositing fat around your organs regardless of what you eat. Research published in the journal Psychoneuroendocrinology has demonstrated that adults who improved their sleep quality from an average of 5.5 hours to 7 hours per night showed measurable reductions in cortisol and corresponding reductions in waist circumference over 8 weeks. You cannot out-exercise chronic cortisol elevation. Sleep is not optional. It's a direct intervention against visceral fat accumulation. The fourth intervention is increasing soluble fiber intake specifically. Soluble fiber, the kind found in oats, beans, lentils, flax seeds, and certain fruits, forms a gel-like substance in the gut that slows glucose absorption and reduces insulin spikes. Research published in the journal Obesity showed that for every 10-gram increase in daily soluble fiber intake, visceral fat accumulation decreased by nearly 4% over 5 years. That's a significant reduction from a remarkably simple dietary change. Soluble fiber is working through the insulin pathway we discussed earlier, reducing the hormonal signal that drives visceral fat deposition in the first place. Now, one important note, if you're currently on medication for blood pressure, cholesterol, blood sugar, or any cardiovascular condition, do not stop taking it. Everything I've described here works alongside medical treatment, not in place of it. In my clinical experience, the patients who achieve the best outcomes are the ones who combine appropriate medication with these kinds of lifestyle interventions. The medication manages the immediate risk, while the lifestyle changes address the metabolic root cause. They are complementary strategies, not competing ones. And please hear this, you don't need to overhaul your entire life in a single week. Start with one change. Swap the refined carbs for whole foods at 1 meal per day. Add a 30-minute walk 4 times a week. Prioritize getting to bed 30 minutes earlier. Each of these changes begins to shift the visceral fat balance in the right direction. Small, consistent adjustments compound over time into profound metabolic improvement. In emergency medicine, you see cardiovascular disease at its most devastating. The heart attack that arrives without prior warning in a 57-year-old who thought they were healthy. The stroke that leaves a 63-year-old unable to speak to their family. The sudden cardiac arrest in someone who had been told their numbers were fine. And what becomes painfully obvious after seeing this for years is that the standard screening tools, BMI, total cholesterol, even resting blood pressure, are missing a critical piece of the puzzle for a significant number of patients. The patients I see who avoid these outcomes, the ones who maintain cardiovascular health into their 70s and 80s, tend to share certain characteristics. They've kept their waist circumference below the risk thresholds. They eat whole foods. They move regularly and with purpose. They manage their sleep. And whether they realize it or not, they've been keeping their visceral fat levels low, which means their liver isn't being bombarded with inflammatory signals, their arteries are staying flexible, and their insulin sensitivity remains intact. Conversely, the patients who arrive with acute cardiovascular events almost always have one thing in common: elevated waist circumference. Not always elevated BMI, not always elevated cholesterol on their last test, but almost universally, a waistline that has been expanding steadily for years. That pattern is so consistent that many emergency physicians and cardiologists now consider central obesity a more reliable clinical indicator of cardiovascular vulnerability than several traditional risk factors combined. There's also a pattern I've noticed clinically that reinforces the science. Patients who reduce their waist circumference often see improvements in their blood work that seem disproportionate to the amount of weight they've lost. A patient might lose only 4 or 5 kilograms total, but because that loss came from visceral fat, their inflammatory markers drop significantly, their fasting glucose improves, and their blood pressure comes down. That's because visceral fat loss has an outsized metabolic impact compared to losing the same amount of fat from anywhere else on the body. The scale barely moves, but the internal chemistry transforms. Part B, the bigger picture. So let me step back for a moment, because this isn't just about centimeters and metabolic pathways. Heart disease is still the #1 cause of death across the developed world. It kills more people than cancer, more than accidents, more than respiratory disease. And the tragedy is that the majority of it is preventable, not with expensive medications or surgical procedures, but with an understanding of what's actually driving the disease process and the willingness to address it. Your waist circumference is one of the most honest, accessible, and free measurements you can take. It doesn't require a doctor's appointment. It doesn't require a blood test. It requires a tape measure and 30 seconds of your time. And it tells you more about your cardiovascular future than most of the numbers your GP writes down in your medical records. The modern food system, the modern work environment, and the modern culture of convenience have all conspired to expand our waistlines without most people understanding what that expansion actually represents. You were never told that the fat around your middle is a functioning endocrine organ. You were never told that it has a direct chemical connection to your liver. You were never told that it's producing the exact substances that cause heart attacks and strokes. That is not your fault. But now that you know, it's within your power to change it. So here's the bottom line. Your waist size is not a cosmetic concern. It is a direct measurable indicator of the visceral fat that is actively driving inflammation, insulin resistance, arterial stiffness, and clotting dysfunction inside your body right now. BMI does not capture this. The bathroom scale does not capture this, but a tape measure around your waist does. Reducing refined carbohydrates, walking regularly, sleeping properly, managing stress, increasing soluble fiber. These are not extreme interventions, they are the metabolic conditions your body was designed to operate in, and they are the most powerful tools available for shrinking the hidden fat that is silently determining your cardiovascular future. If you found this video helpful, please subscribe to the channel and hit the bell icon so you don't miss the next one. Share it with someone whose health matters to you, someone who deserves to know what their waist measurement is really telling them, and leave a comment below telling me what topic you'd like me to cover next. I read every single one. Thank you for your time, and I'll see you in the next video.